Now, the way to know whether or not you're experiencing acute stress disorder already or post-traumatic stress disorder, not really so clear. In my head. Hey everyone, it's Ryan Liberty, and today I'm back at Kings Park Psychiatric Center, the closed down mental hospital, and in this location I'll be talking about acute stress disorder versus PTSD. What is the difference between the two? Because acute stress disorder is kind of new and a lot of you probably haven't even heard about it, so let's discuss that today. So really quickly, acute stress disorder and PTSD, they have very, very similar symptoms, and that's because the main difference between the two of them is that acute stress disorder lasts for 1 month or less, and PTSD lasts for longer than 1 month. The symptoms are things like intrusive thoughts about a trauma that we've undergone. This all stems from trauma, but you may have these intrusive reminders of the trauma, also known as flashbacks. You may experience dissociation, where you don't really feel connected to your body or your environment. You may have negative thoughts about yourself. You may blame what happened to you on yourself or blame it outwardly on other people. Basically, you re-experience the trauma over and over again, and it may lead you to avoid situations that remind you of the original trauma that you experienced. It's starting to get really dark out here in the woods. So let's quickly talk about trauma, because trauma affects people differently, and that's because there are different portions of trauma, different stages to trauma. So you have pre-traumatic, peri-traumatic, and post-traumatic, which is basically before, during, and after trauma. And what happens during those stages can affect how you react to trauma. And what's really important to understand is that not everybody's going to become traumatized after trauma, and not everybody's going to develop acute stress disorder or PTSD. Now, acute stress disorder came into focus when they had the DSM-4, the Diagnostic and Statistical Manual, which is what every therapist uses to diagnose somebody. Acute stress disorder was meant to be a placeholder to try to understand what does somebody go through before they progress into post-traumatic stress disorder, because they recognize that some people do go on to develop post-traumatic stress disorder after a trauma and some people don't. So what's going on? And they needed like an in-between for the people who experience symptoms of trauma, maybe a little bit on the lighter end, but don't go on to full-blown post-traumatic stress disorder. Now, research seems to have shown that creating acute stress disorder as a category actually is beneficial, and it is somewhat predictive of whether or not somebody will go on to develop post-traumatic stress disorder. But there's something important that we have to note that research has found. The most important thing that research seems to have found about acute stress disorder is that it seems that the severity of the trauma symptoms is what will predict whether somebody will go on to develop post-traumatic stress disorder after 1 month. The research also seems to suggest that trait anxiety, so your general baseline reaction of anxiety to stressful things, as well as having a negative evaluation of the trauma that you experienced, those seem to predict whether you will go on to continue having PTSD, where if you're experiencing those things, if you evaluate the trauma as some kind of horrible event in your life that you can't overcome, and if you just react anxiously to it, more anxious than somebody who maybe has some better coping skills, that will likely lead you towards post-traumatic stress disorder, towards PTSD. Now, what this means is that if you're somebody who's experiencing acute stress disorder after experiencing a traumatic event, and you want to work on some prevention methods from developing PTSD, then you'd want to work on managing your anxiety and working on your negative evaluations of what you've experienced, trying to recontextualize the trauma that you've gone through. Now, the way to know whether or not you're experiencing acute stress disorder already or post-traumatic stress disorder, not really so clear, because we have to look for that 1 month mark and measure from there. So nobody's going to be able to tell you until you get past that 1 month mark whether or not you're experiencing post-traumatic stress disorder, because it's really just kind of an arbitrary time length to measure what's going on. The big takeaway from all of this is that the way that you react to the trauma that you've experienced can determine how severe your symptoms are and if you go on to develop a more severe disorder. The good news is that whether you have acute stress disorder, whether you just experienced the trauma, whether you've gone on to have PTSD, you've had it for a while, even if you suspect that you've had complex post-traumatic stress disorder, there's treatment along all stages and you can heal from all of this. There are many therapies that have been tried and tested, and if you go in to see a therapist, the earlier the better. You can get help and you can heal from all of this. Now, if you're somebody who's experienced one of these things, I'd love to hear your thoughts on this. Leave a comment down below so we can all learn from each other. If you want to learn more about mental health, I have over 250 videos here. Hit subscribe, hit the bell after you hit subscribe to get notified each time that I do a new one. And my mission here is to help humanize mental health. If you want to help me on that mission, you can head on over to Patreon. I'll put the link above. As always, I want to thank you for joining me here. I have to get home before the lights go out, and I'll see you next time, everyone. Take care.